Hello, everyone. Welcome to this session on fertility care, the new employer opportunity to build an inclusive, innovative, and cost-effective benefit. We have a great lineup of speakers who will share their insights on how to effectively offer fertility benefits and promote a culture of inclusion in the workplace. It's my pleasure to now introduce our presenters for this session. Dr. David Adamson, founder and CEO at Art Fertility, Barbara Kalura, President and CEO at Resolve, the National Infertility Association, and Elizabeth Maddox, Director of People Operations at PixArt. Dr. Adamson, Barb, and Lizzie, thank you so much for being with us today. I'd now like to turn it over to Dr. Adamson to get us started. Thank you.
Thank you very much, Arita. It's great to be here at the World Healthcare Congress and want to thank everyone who made this possible. And I especially want to thank our attendees for showing up today. We hope you're going to find this an interesting session. We're going to start with a very short presentation from each of us, and then we're going to have a panel discussion, and we'd be happy to hear any questions that might come in so we can answer them to you after the session is over. So thanks again for showing up. So it's really a pleasure to be able to present about employer fertility benefits, because we want to help companies support their employees on their fertility journey. We all know that employers are really being challenged today more than ever to provide inclusive benefits for their staff. The benefits have really changed a huge amount in the last few years, and many of the traditional benefits have become somewhat irrelevant. We also know there have been a lot of changes legally, especially with the Supreme Court ruling last year about the 1964 Civil Rights Act and its application to the LGBTQ plus community. And this has really changed a lot how people are looking at different types of benefits in the workplace. It's also important that with the different generations that are coming into the workforce, there's really a very, very diverse workforce and style. COVID has really accelerated that as well with all the at-home work. And so all the differences in age and gender and race that our society is now really dealing with have created a great need for change in terms of how benefits can be applied so that they really meet the needs of employees today. It's also been shown in the literature that the most cost-effective provision of fertility care comes through well-managed program with subspecialists, where really good application of knowledge and evidence starts up front to avoid waste and inefficient care. It's not generally known that 1 in 8 people suffer from infertility. This makes it more widespread than cancer or diabetes, and yet most people are not aware of this. Infertility has really been an underappreciated disease, and one that's a huge burden on many, many people who suffer from it. This is just now, with all the other changes in society, becoming more visible. Some of that might be because of all the news around the dropping birth rate, and also the fact that during the pandemic, people have become much more focused on the importance of family and what their personal lives are like. So there's a lot of social changes that are driving an increased appreciation and awareness of how important infertility is, and how it's important for employers to pay attention to it. And this is especially true because the infertility journey that people go through really affects presenteeism and productivities in companies. Despite the large number of people who have infertility issues, only 1 in 4 people get the care they need. And the greatest reason for this is that there's inadequate or limited employer coverage. And this is far and away the most common barrier to people getting the health care they need for this. Infertility by itself is a very stressful and emotional, challenging life burden when people go through it. And this obviously causes anxiety and depression and upset, not only in people's personal lives, but this flows over into the work life and does affect the amount of functioning that people have at work, and also their presenteeism and productivity. So this is a very common problem. It's a big problem. And fortunately for us, it's getting a lot more awareness, and very importantly, there are now many more solutions that can be helpful to employers to deal with this issue in the workplace. And we're very fortunate today to talk about those and how we can help employers with that. And with that, I'd like to turn over to Barb Kalura, who's President and CEO of National Resolve, who's going to talk about the patient employee perspective and the types of activities they've been doing around infertility and fertility care. Barb, it's great to have you today. Thanks very much for joining us.
Oh, well, thank you, Dr. Adamson, for having me. And you know how I love to talk about the work that Resolve is doing, as well as how people can access care. This is really kind of why we exist. So just to level set, who is Resolve? We are a nonprofit patient advocacy organization here in the United States. We help people who are struggling to build their family. We provide community support, advocacy, public awareness, of course, patient education. We were founded in 1974. So we've been around for nearly 50 years helping this community. What a lot of people may not realize, and Dr. Adamson, you just touched on it, is sort of the all-encompassing way that infertility affects people's lives. And we know this so well because that's the community that we serve. And so it affects them, certainly their health, it affects their relationships, it affects their finances. We've heard about their work balance. It also impacts their faith. It's really all encompassing in how it impacts their life. And so when we look at that family building journey, that work environment is an incredibly important part of their journey. In fact, we oftentimes hear from our community about how difficult it is to pursue medical treatment because their work environment is not conducive to supporting their goal of building a family. And that in and of itself presents a host of problems. In fact, a few years ago with David Adamson's firm, we did a survey of patients and we asked them, how did they view their employer? How did they view their employer if they had offered coverage for IVF, and how did they view their employer if they did not? And this data is publicly available. And what we learned is employees have a tremendous sense of connection and commitment to employers when they're helping them build their family. They're far more likely to refer it as a great place to work to friends and others, and just feel as if that work environment is incredibly supportive. We know how important those family-friendly benefits are for employees, but oftentimes the infertility coverage piece is overlooked. And we just think that that needs to be something that employers are thinking about. I want to share too that one of the goals at Resolve is to encourage your employees and employees all over the country to advocate for this kind of coverage. We are seeing more people willing to talk about it and share. It's still highly personal and highly stigmatized, but if we can get just a few people in companies and workplaces across the country to say, hey, this is really important to me, and there's got to be others here that care about this, we find that that is incredibly motivating for employers. So I want you to know that what we're doing is we are working on hundreds, if not thousands of people to speak up and advocate within their workplace. We are arming them with data to bring down to the HR folks. And we think that their personal stories are the ones that are going to be most compelling to employers in wanting to add this. We also see employers really looking at this as a benefit. We oftentimes get contacted by employers saying, hey, we just did an employee survey and we asked them a number of things that they care about. Infertility is on the top of the list. Of course, it's not surprising to us, but it's something that all of a sudden they are paying attention to because their employees are telling them how important it is. So again, we are thrilled to share this perspective with you, and we're a resource to you, we're a resource to employers, and obviously we're a resource to employees. And we want to see everyone have the ability to build their family. So there you go, Dr. Adamson, and I'm excited to share and talk about this with you and with Lizzie.
That's great. Thanks very much, Barb, and thanks for all the work you and your organization have done now for decades for many people with this problem. We're really, really delighted today to have Lizzie Maddock with us from Pixar. She's the Director of People Operations and just a really enjoyable and knowledgeable person about benefits in her company and about infertility. And so, Lizzie, it's wonderful to have you to talk about fertility benefits from an employer perspective and how you looked at it and what your experience has been.
Great to be here. I do have a huge passion for this topic. I had my own personal fertility journey, so I have a personal agenda when it comes to benefits from the employer side. 5 years ago, I started my journey to start a family, and I didn't have anything like ARC Fertility. And I had to come off my insurance at the company that I was at to go on my husband's, who worked at a very large company. So larger companies obviously have a better advantage when it comes to the insurance versus smaller companies where you're limited. So when I found out about ARC Fertility and did my research, when I started to become more involved in the benefits at Pixar, that was naturally something that I wanted to look at. Obviously, I'd been through it. I wanted to help people. So when I was researching the different solutions and presenting to the board and our finance team, ARC Fertility was definitely the best solution for a company of our size. It gave us the flexibility of being able to help where we can. So that's we've been with ARC for a couple of years now, and we've been delighted. So the challenges that I had with looking into the fertility benefits for our employees was, was it fair? We looked at whether we could have it through our insurance, but unfortunately, because we're not a large employee in the States, some carriers don't even offer it. And when they offer it, it's only for a medical reason. So you're excluding people from that benefit. So that was one challenge. The cost of it, obviously, presenting costs to financial people, it's like showing the value and where the money's going. And like we've discussed, it's not a topic that people are willing to talk about openly and often. And if you haven't been through it before, you don't understand. You could need it in the future, but you would be oblivious. Like, I never thought about it before I realized that I had issues. And then and you're also competing with other benefits. Companies are providing gym memberships, they're providing the wellness courses. There's such an array of things that are important to each person. So you are competing with those as well. For me, showing care for all of our employees is always a positive thing. Fertility and helping people through this process, we've talked about the stresses. There's no way to understand all the ins and outs of people's stresses, and it does overflow into your work life. So if you can just think about cutting out one stress from this process, you're going to help someone in the biggest way. So that's going to be a huge positive. And you are going to get a satisfied employee. It's going to lead to retention, and it's gonna help you compete against companies with richer benefits. And if you aren't in a position to go all out, anything, any little helps in this process. Anything. Being there for your employees, being willing to listen. A lot of times when I had a conversation, even out of the workplace, you can just see people shying away just because it's not one of those topics that people are comfortable. So my advice, if you are looking into this, be willing to listen to people, be open as possible. And if you do have these benefits already, make that information accessible so people don't have to come to you. Some people might be uncomfortable, going to HR and being, hey, I've got problems. Can you help me? Like, not many people want to alert their workplace that that's their plans. So having that communicated to everybody, and especially leaving those judgments out of those conversations. So don't assume somebody wouldn't be interested in it because you don't know where people are in their personal lives. So yeah, that's a bit about me and my perspective.
Lizzie, thanks very much. That was really wonderful to hear, how the patient experience that's in their personal life, but it does have a real impact at work, and all the different factors that obviously employers have to think about, when they're looking at a benefit. So I just want to give a few comments about what it looks like from, benefits provider, because at the end of the day, infertility is a big problem, and companies have employees who have these issues, but at the end of the day, you have to deliver, something that's going to help the people. And so I wanted to talk a little bit about that and some of the things that, what we've seen in our journey of providing these benefits. It's really important. And the first one is access. I mean, you can have whatever you have, but if you can't make it accessible to the employees, then it doesn't really help very much. So we think that one of the reasons that fertility care is so important these days is that in order to give access to everybody, and in particular the diverse community, and to be inclusive, in particular of the LGBTQ plus community, many of whom need fertility care in order to start their families. So they don't have infertility in the traditional sense, although the LGBTQ plus community and single people are included in the new definition of infertility and fertility care. That, in other words, there are people that aren't in a heterosexual marriage who need help reproducing, and this is where fertility care can be most not only helpful but essential in order for people to have their families. So one of the most important things about fertility benefits is to make sure that they do meet the DEI goals of the company, which means that everyone can access them. It might be a couple who can't get pregnant on their own. It might be a woman who has to undergo chemotherapy for breast cancer, needs to freeze her eggs, or people in a different gender relationship, men or women who need help to get pregnant. So it's important to make the benefit really accessible to everyone. And I think there certainly are programs out there like that. But historically, a lot of the traditional benefits from the traditional carriers have been exclusive, and they have not included many of these people that I've just mentioned. I think the second part of access that's really, really important, across the country in the US, only 1 person in 4 gets access to care they need. Number one reason is financial. And so Lizzie pointed out that any level of subsidy can be helpful. So we know that not all employers can pay, the full cost, for example, of something like gestational carrier surrogacy, which could be way over $100,000. Employers can't even think of that in many, many cases. In most cases, they can't. And yet any subsidy, even $5,000 or $10,000, when a person actually needs it, may not cover everything, but it'd be a huge help to get them the kind of care they need. And then they can look for other assistance in other places. There are programs that can do that. I think the second really important part about providing these benefits is the quality of care. We all know we have a very expensive healthcare system where there's a lot of waste and issues that they're occurring with the lack of cost effectiveness of care. And so one of the really important things, I think, is to have centers of excellence where you really have specialists that are going to bring a high degree of knowledge and expertise right up front to the problem. So you make the right diagnosis, you get on the right treatment plan, and you base that treatment plan on evidence. There's a lot of good evidence about how to treat infertility. And by doing so, getting good outcomes. There's still sort of a myth out there that most infertility care results in twin births or even triplet births. And while certainly that has been a problem in the past, there's no question about it. It's important to note in the last 4 or 5 years, the twin rate's been brought down dramatically, as has the triplet rate's practically non-existent now. And indeed, by having a fertility program, you can avoid having these bad outcomes that occur. If there's some type of traditional insurance that doesn't really cover infertility, then what happens is people take risks, they get bad quality care, end up with high cost of maternity and NICU costs. So the quality of care really matters. That comes down to the benefits provider and the doctors and the clinics that they're using. It's also important these days, of course, to recognize how inclusive the patient journey needs to be. I think we're all realizing that the healthcare system can be pretty impersonal. And especially since this is such an individualized and personal journey, it's important to have personal care, provide a lot of emotional support through this. This comes back to the providers and the ancillary services around the fertility benefits, which certainly are available now in the programs that are out there. And of course, it's important these days to wrap this in a digital blanket, if you will. Most people are going to start this journey digitally, either on the web or, of course, on their cell phone. And so it's very important to look at programs that have a comprehensive digital presence that's also individualized, that gives feedback to the individual patients, helps direct the care, again, uses evidence, fact-based care, sends people to good resources, such as Resolve or American Society of Reproductive Medicine, reproductivefacts.org website that give good information, and the employees can then take that to get into care at a good place. And finally, of course, all this would be great, but if it's not affordable, it's never going to happen. And as someone who has been a business owner as well as a physician for over 3 decades taking care of infertile patients, I know that affordability is the number one issue. And to make a program affordable for different employers of different needs, it needs to be very flexible, a kind of program design with the level of subsidy that the employer wants to put in. Needs to be administratively simple, and of course, the program needs to be cost effective for the employer. So these are some of the factors that I think are important for programs when employers are looking at these. Needs to provide inclusive access, has to be quality providers, has to provide a comprehensive patient journey, both personal care and digital, and of course, it needs to be affordable for both the employer and the employee. And so with that, we should probably move on to a few questions and comments and have a bit of a panel. So perhaps Barb, would you like to start out and maybe talk to us a bit about why do you think fertility benefits have lagged behind so many other healthcare benefits?
Gosh, isn't that like the $1 million question? I get asked this all the time by the media and others as well. People kind of scratch their heads and say, gee, what's involved with all of this, and why hasn't this been covered like other medical conditions? And first of all, I think you've raised a couple of these. I think there's been some myths about every pregnancy is going to result in a triplet birth, and that cost is going to go through the roof. One of the things that I know just in my tenure here at Resolve is that if people who are impacted by infertility are not speaking up and are not advocating, how are we all going to know that this is a problem and that this is an issue? And so that's one of the big things that we have been working on, Dr. Adamson, is just really equipping people so that they feel supported and they feel comfortable and confident, and they understand the power of their voice, right? And they understand the power of advocacy and being able to make that ask. So coming out of their silence and their sense of being alone and being in a position to start talking about it and sharing. Where we've seen that happen, that's where we've seen some real progress. But again, this is a lot of stigma. I liken it to kind of where mental health, even breast cancer, was, for perhaps 25, 30 years ago. So we are getting there piece by piece, but it's forums like this where we have an opportunity to really broaden the perspective of just another group of people, I think is really important. But, you're a physician, you've been seeing patients for so many years. What have you seen as some of the reasons, Dr. Adamson, why this hasn't been universally covered?
Well, I think you've really touched on the main ones. I think most people haven't realized how big a problem it is. They don't realize the number. Now, in any given year, about 1% of people will have infertility and need fertility care. So for an employer looking at this, it's not that 1 in 8 people will need to use this every year. It's that 1 in 8 in that person's reproductive lifespan will, but on a utilization basis, it's about 1% a year. But the employers haven't really been aware of it. Society hasn't been. It's not just the employers. And secondly, there have been some legitimate concerns about the cost of multiples. For a decade or so, there were high levels of multiples, and so employers shied away from it. And also, I think they haven't realized that because this is such a hidden disease, that in fact, they've actually been spending a lot of money on it through their traditional plan, with people, getting fertility services that were miscoded. There's been a lot of waste of money through this. Some of the studies out there suggest that 10 to 30% of infertility costs are just wasted money with inefficient care that goes too long, simply because it gets covered by the traditional plan, even though it's not the right care for the employee. And so I think there's just been as you mentioned, there's been a lot of myths about this, and it's a very personal thing, and people are very reluctant to talk about it. So it's sort of been hidden, a lot of myths about it, and some of the facts have not been attractive, like the cost multiples, but that's largely been dealt with now. And in fact, one can show that with a fertility benefit, the cost is probably not much more than not doing anything, and you can provide a lot of value for employees. So I think things are changing, but it's been a while for this to come about.
Well, and that just dovetails right into the next question that I think I get a lot. Why now? Why is there interest in fertility benefits, today? What do you think has caused us to see this growth in interest, and even people coming to you and coming to us asking about it?
Lizzie, what do you think about that? Because your company got fertility benefits. Now, why do you think there's some more interest? What's happened?
I think the conversations are starting to happen, and especially with last year, we're all working from home. Our home lives and work lives are integrating more than ever. So companies have to be more understanding that we do have families in the background, but we can work at the same time. So I think companies have to open up to helping people more at home and helping people, with their journeys, whether it's family. And then also on the fairness, diversity and inclusion and equity, I think that's definitely something that last year exploded. And if we take a look at what we're providing with people, making sure that we're not being exclusive, including everyone, I think that's why it's a hot topic at the moment.
Well, and Lizzie, I don't know how it worked with your company, but we're also seeing that when we go in to advocate with an employer, when this has also happened, with the C-suite, and certainly it's happened with legislators, now people are having their own journey with infertility, their own personal experience. And so while they may not have necessarily thought about, oh my goodness, the workplace, and you're a perfect example of this. You went through it personally, and now you're looking at your workplace going, I think we can do better. And so we're starting to see that as well, where, and Dr. Adamson, that could be because there's more women like Lizzie in positions of decision-making and power at companies, but we are certainly seeing it, people coming out.
And I think what you're saying, our society now is talking about a lot of issues that were not talked about before, right? Yeah. We're talking about a lot of issues around gender, a lot of issues obviously around race, talking about issues of work and home. And fertility falls into that, all those categories basically, where things that weren't talked about before, now can be talked about. And this I think is why we're seeing the conversation. And once people talk about it, they say, gee, this really is important. The other thing is, every year, a lot of babies get born from IVF. In this country, it's 67, 75,000 or so a year. And so what's happened now, there are a lot more babies and children out there that came from IVF, and almost everybody has a friend or a relative who's had an IVF baby. And so as that's happened, the whole process of reproductive care and fertility care has become more normalized. And it's not like, well, that's something that happened somewhere else. They say, no, I know Johnny, and Johnny's an IVF baby, and Johnny's terrific. Yeah. He's the best pitcher on the baseball team, right? And all of a sudden, it becomes more normal and routine. And so people are more comfortable talking about it. So I think there's a lot of societal trends that are causing this to be more recognized and more supported.
Yeah, absolutely. And I think when I first started, I was very quiet about it, but the stress for me at work, like having to leave work, and at the time I had a new boss starting, and I was so nervous about like taking the time off. So I think that's another thing that people just don't think about. You have to get so many checks to make sure everything's going okay, to check the progress. So you are missing out on work, and that is like, if you're passionate about your job, there's something that you definitely care about. So I came out right and said it, what I was going through, and that just felt so good for me. And I've found over the years, the more open I am, the more people will respond. And so many people in the workplace are going through the same things. Mm-hmm. And with the traditional going through insurance, when it was just on the woman, so that excludes 50% of your workforce there and then. So if there is something that you can provide where the man can do it, like in all the situations, it's just, yeah, I think that's why more conversations are opening up. It's not just limited. So yeah.
Lizzie, what in your opinion, and certainly at your company, what have been the opportunities, for you and as an employer in offering this kind of benefit?
Oh, lots of opportunities. Like I've seen over the last 2 years, more and more people interested in it in the first place. So actually offering it, people are asking for it now. People are wanting it as part of their package. And it goes for other benefits too, like especially in we're in the tech space. The benefits is such a huge part of people's compensation. It's not just about base salary anymore. It's about the whole package. It's about the lifestyle. It's about whether we are welcoming to families. So being able to provide help in the fertility arena definitely gives us an advantage, gives us a platform to be able to speak about it. It helps us with our diversity and inclusion values too. There's just, for me, there's no negatives. Like if you can help someone through this process, that's so great.
That's great.
Yeah.
Dr. Adamson, what about the brokers? I mean, what is their role, and how can they best help their clients in getting this kind of benefit?
Well, I think the first thing is to get the information out there. I think it's really important for people to start to become aware of infertility and fertility benefits, just to know that this is an important problem. I think that's number one. And so to raise the issue with employers, I think that brokers should hopefully be knowledgeable enough now as we go forward, and they're looking at a wide spectrum of benefits. They say, well, I should bring this up to the employer and have them think about it, and then to bring good information about what types of approaches they could take, how they decide they want to approach this, and to be knowledgeable about the different types of programs that are available for employers. And again, coming back to the fact that there are a lot of solutions now. It's not like this is just a problem about which you can't do anything. I think the programs give a lot of options for employers, to bring accessible fertility benefits for everybody, but to have high quality, make it cost effective. By the time you cut out waste and reduce multiples and get a flexible program that can make it affordable, I think if the brokers are learning about this, the advisors are learning about this and can tell the companies, I think the really most important thing is simply education. Mm-hmm. I think the argument for fertility benefits speaks for itself if you have an informed person. So I think the best step is to learn about it, and certainly, contacting, us and those who are out there providing these benefits is a way for them to, to learn about it and be able to present the information to the employer. So, Lizzie, what are your thoughts? I mean, what would help you the most when you were looking at this from your brokers, your advisors?
I completely agree. I think the biggest thing for me is the broker being educated and knowledgeable about it, just because there's so many complexities to it, and some plans can be misleading. Some plans could look good, but actually it's only half of what it's looking like, and it's a lifetime. So being knowledgeable in it, and being able to pass that knowledge on to the person in the company looking at the benefit, because even me being through it personally, like, I had to look at things twice, because there's assumptions when you think fertility, you think IVF, but there's so much more to it. Like, I went through 6 months of different fertility before even getting there. So I think number one thing for me is being knowledgeable and being able to present that information in a digestible way, and for those representatives to be able to speak about it to different people who aren't in the know.
Right.
Yeah, and you guys said it, but we've talked about these myths, and if there's a way that that those brokers can kind of be the truth tellers, right, and dispel those myths, boy, that would be such a benefit and such a, no pun intended, but such a value to folks like Lizzie and others who don't know all the ins and outs. So yeah, I think that's going to be key.
Yeah,
Lizzie, once the advisors, brokers are knowledgeable and they come to an employer, for someone like you, who's in HR, people operations, what did you find are the sort of the most important characteristics about a benefit that the HR person needs to take to the finance person to get this through? You said you talked to people, but were there any aspects of this that were pretty easy, or were there aspects of it that were a bit more difficult, in terms of making your case? Once you get information, what's the most important thing for you to know so you can be effective in making your case in your company?
Yeah, absolutely. So showing the value of it, anything that you take for approval, you need to show what the value is. So if something is out of reach or just not available to you as a company, it's not going to work. So it needs to be able to be affordable, flexible. So companies are changing so fast, they're growing so fast. So next year we might be able to offer more to our employees. So something that is flexible and can work around where your company's at, I think is really important and valuable to the company. More importantly, value to the individual, because if there isn't value to the individual, there's no point in the company doing it. So having confidence in what you're offering is going to be a good service, so they get a good experience, is going to be key too. And that spills over into their work-life balance, having that good experience. Like you were saying, being diagnosed correctly could save months and months and months of stress. What that would do for the individual's productivity is great.
And
so
no, I mean, Lizzie, those are all so key from the employer perspective. I'll tell you that this can be a complicated, medical process. And so what we've seen, Dr. Adamson, is the administration of this benefit, but also the resources available to the employees. So are there opportunities for the employees to call and get questions answered? And, is there information available? What about, gosh, if you need emotional support, how do you navigate that? So I think that there really needs to be a focus on what are the resources and support mechanisms for your employees who might be going through this. And you don't always think about that. People are always thinking about what's the benefit design and what does it cost, but thinking about, wait a minute, now I'm on the employee side, actually using this benefit. What are the things that are going to be really important that are in place? And gosh, wouldn't it be incredible peace of mind? I'm sure, Lizzie, you have this, is knowing that when your employees start using this benefit, they're going to be taken care of. And I think that is hugely important.
I completely agree, Barb, and you both pointed this out, but it can be a very complex journey. I mean, it's a complex journey medically and emotionally and financially and over a period of time with a lot of decisions. And so to have that support when you have a fertility benefit, you want one that's really comprehensive. It needs to be both digital and individualized, but then with real personal care. When you need that personal touch, you need to have that personal touch. And obviously, as a physician, it has to be high quality care. There are a lot of things where money can be wasted on things that aren't going to help much. So you want to have a quality program. So the benefit needs to be comprehensive and high quality, but at the end of the day, it has to be very affordable too. But of course, if you do evidence-based, cost-effective things, and you're actually going to save money because you're not wasting money, which is really important. And also, programs there now are very applicable to everyone in the company. This is the thing about a good fertility benefit is not just going to be for the 1% of employees a year who actually use that benefit and need medical care, but the other 99% of employees can benefit from really excellent knowledge that's individualized about their reproductive health, which really means their personal health. And by taking action when they're planning to have a family later, they want to have the right lifestyle for a family so that they're eating well, exercising, not smoking, taking care of the things they need to do to prevent disease. In actual fact, that I think there can be real cost savings. There can be cost savings from improving the general reproductive wellness, which means the health wellness of all employees in the company, not just the ones who eventually end up needing to have medical care. So I think there are a lot of advantages. And again, as Lizzie pointed out, there's opportunities for the employers to provide a really good benefit for everybody, but then specialized, personalized, supportive, and comprehensive for those who really have to go through this most difficult situation in life. And the other good thing is that while nobody can guarantee 100% success, the reality of it is that the success of fertility treatment now is very, very high. And anywhere from 50 to 90% of people can have a baby, depending on their age and other situation, but it'd be very, very successful treatment to get a healthy singleton baby. So I think we just about run out of time. It's been really fun talking with you, Barb and Lizzie. Thank you so much for joining us today. I hope we've helped people learn a bit more about infertility and fertility care, and that they can take this information use it in their work every day, advising employers about fertility benefits to their employees. So thank you very much to Aretha and World Healthcare Congress for making this possible. Everybody have a great day, and thank you again.
Thank you.
Thank you.